Alright. Okay, I'm going to move the camera first, sorry. This is a reply to reedmoh's comments on my hate being interrupted video. First of all, hi, thanks for the comments. I wanted to make clear first of all that I really appreciate what you were trying to say, and if my situation were different, it could very easily be quite valid. The length of the response that follows reflects, I hope, how seriously I've taken your comment, because I do take it and my own health very seriously. That's why I'm going into treatment for my eating disorder, and it's why I've put a great deal of thought into why I think I need to take Prevacid right now. So I do hope you'll hear me out. I don't really like being on such a strong medication, a proton pump inhibitor to be exact. Yes, I'm well aware of the type of medication I'm on and exactly what it is doing to the acid production in my stomach. In fact, PPIs inhibit about 90 to 95% of the acid production in your stomach, leaving you with only 5 to 10% acid still remaining. In a normal person's stomach, that could very easily be dangerous, and that's why doctors shouldn't prescribe such strong medications for people with normal heartburn. However, before Prevacid, I had previously been on Zantac, or ranitidine, I think that's how you say it, for about at least 7 to 8 months, I think. My doctor prescribed this much less strengthy medication because I was a voice major and I had essentially lost the full use of my voice due to the reflux of acid on my vocal cords, which, as I have become aware, is actually an unusual presentation of reflux, since most reflux doesn't get past the esophagus windpipe barrier. But, as I discovered when I stopped being able to sing, mine does. There is a special name for that type of reflux, but I can't remember it right now. I'll look it up and post it in my summary or as a comment to this video, probably. But anyway, my vocal cords basically got fried due to the amount of acid refluxing through that obviously weakened in me barrier. I had the scope, as I like to call it, down my throat to confirm that I in fact had reflux, and suddenly I was told I had vocal nodules. Now, I had never abused my voice. In fact, I always took great care not to overexert or strain my voice, especially since I was a vocal major in a classical music program, so that was really important. I had been vocally trained since the age of 7. There was almost no way that I could think of that I had possibly gotten nodes on my vocal cords, because nodes are almost always associated with vocal abuse. No way, that is, except acid reflux disease. The first time I had reflux symptoms which were of a more generic nature other than the voice loss, after my initial diagnosis of GERD, or gastroesophageal reflux disease. I was put on Zantac, and for those 7 or 8 months I did not have a recurrence, or so I thought. However, the next year I arrived back at music school, only to discover during my first voice lesson and chamber choir auditions that I did not have a voice left. My voice had become extremely small and weak and airy, and would start to hurt me excruciatingly after I'd only been singing for 5 minutes, or if I was lucky, 10. I barely made it through the first few weeks of auditions. My voice lessons basically had to be put on hold until after my throat was repaired. So that's when I went to see my doctor about my severe vocal symptoms, and she prescribed me Prevacid. That's its brand name. The generic name is too hard for me to say, or else I'd say it. I can spell it out for you, though. Lansoprazole. Anyway, my doctor told me that Prevacid would not only greatly inhibit my stomach acid production, but would also help to heal my vocal cords. Of course, the reason it helps to heal the voice is because there's not really enough acid left to reflux back onto the voice when 90% of it is being stopped by a drug. But, you know, I didn't really care, honestly. I needed my voice back because my whole academic career and this really important choir audition were absolutely dependent on my physical ability to sing. So I began to take the Prevacid, and within 3 weeks I was able to sing almost normally again. It probably took another week or two for my voice to be fully healed, but academic and choir singing were both at least possible again after those 3 weeks. And yes, I did make it into the choir after, because my voice was better in just enough time for the auditions where my solo voice really counted, which I was very thankful for, because that choir is very prestigious. I really wanted to get in. So, my decision to stay on Prevacid for the longer term has been tempered by many things. There isn't the fact that my short-term discomfort is extreme when I've missed my Prevacid, which I have missed on several occasions. My stomach becomes a huge acid pit. Inevitably, after several hours of this, I get lovely symptoms such as major esophagus burning, vocal pain and strain, and really bad nausea. I would deal with this for a few days to normalize the stomach acid, though, if I didn't also have other problems. See, my whole acid reflux problem began when, at the age of 18, or 18 and a half, in my attempt to be healthier, I changed from eating, get this, okay, a greasy pizza and a Coke at lunch, to a white bread sandwich and an apple juice at lunch. Okay, you'd think that would be better, right? But my digestive system, although it had been quite accustomed to processing grease and sugar, seemingly couldn't handle the healthier but much differently constructed acids and therefore reflux triggers in white breads and citrus juices. Having wined and dined myself on meals full of grease and artificial sugar since about age 14 clearly somehow changed for the worse my whole digestive system. I ate these things for weeks, like the sandwich and the apple juice I mean, hoping that my stomach would get used to the new acids, but they did not. I have in later situations found it necessary to completely avoid basically any foods with any taste when I'm not taking reflux medications, because foods with taste are the ones that have fats, starches, or acids in them, all of which trigger acid to reflux into my esophagus to extremely uncomfortable and damaging proportions. I've had the scopes to prove that, and have personally seen the images of my own vocal cords, where scars from those vocal nodes I was telling you about were plainly and scarily visible. It doesn't really hit you how much the reflux has actually hurt you until you see two perfectly symmetrical sets of white scar tissue, which may or may not be on your vocal cords for life now, because you stupidly and ignorantly chose a poor diet as a teenager, ignoring any warning signs that your diet might be less than adequate. Going into why I ate so badly then would take too much time, so I'm not going to do that now. So I really just wanted to let you know that I'm not an ignorant 20-year-old blindly following doctor's orders. I've done a lot of reading and thinking and self-research about the causes of my acid reflux disease, and I believe that, at least for now, Prevacid is a good choice for me. Maybe at some point in my nutritional future, I hope that I'll be able to find someone who can help me slowly adjust my stomach to normal eating again, someone who can help me repair the damage that 4 years of compulsive overeating of horrible foods did to my digestive system. Until that time, though, I really think that Prevacid will help me far more than it will hurt me. To me, it's not worth having vocal nodules, a condition that can sometimes need significant physical therapy or even surgery if it gets bad enough, because some doctors prescribe Prevacid blindly and some patients take it without thinking about the consequences. Thanks for your reply, though. I mean, I'm actually really glad that you brought that up. So I hope you have a good day, and take care, and reply if you want to. Thanks, bye.